cranial base or suboccipital release technique. Our goal here is first to identify regions of hypertonicity that may or may not harbor myofascial trigger points that reproduce for the patient some of their familiar chief complaint, either pain, tightness, irritation, whatever they notice, and especially if this is a radiating pain syndrome that extends into the cranium, then this may well be a tension type headache scenario, and if one of those pain generating muscles happens to be in the suboccipital group, then this technique is very effective for helping to reduce their activity and generating the headaches. So first we palpate, and we can find a spot of hypertonicity. We can check in with the patient and ask, is this tender at all to pressure? And so it is. And then checking in with your patient, making sure it's not too much pressure. We'll begin by supporting the posterior aspect of the skull in the cupped palms, and we can let our fingers just be relaxed, partially flexed, kind of in this position. So we have our relaxed, partially flexed fingers. Then, as we would like to continue to apply more pressure, checking with the patient if this is an okay amount of pressure, then we can start to bring the palms away from the skull so that now the weight of the skull is resting in its majority at your fingertips, which are pressing on the muscles. So the other key to this is that we're doing a superior pull with our fingertips so that the musculature is being pressed against the inferior aspect of the skull, like so, rather than pressed anteriorly into the sensitive neurovascular elements that occupy the suboccipital space. So what we're looking at here again is this lift or this superior traction of the tissues so that you can exert your pressure against the skull through the muscles. So you have the muscles pinned between your fingertips and the skull. Any questions on this one? Great. Let's partner up.